I'm Richard Thomas. I'm a knee and shoulder specialist at OrthoGeorgia, and today I'm going to be speaking about rotator cuff tears. Rotator cuff tears are an extremely common orthopedic problem that causes shoulder pain and weakness. We typically see patients with rotator cuff tears actually in their late 50s, 60s, and 70s. We don't usually see rotator cuff tears in younger patients. The reason for this is as we get older, our rotator cuff gets thinner and thinner and then eventually tears. Usually a rotator cuff tear is not a traumatic injury, but actually more of what we call an attritional injury, where the rotator cuff just gets thin and fails. Usually we can diagnose this with x-rays and an MRI, which is a special type of x-ray where we look at the soft tissues. And the treatment for rotator cuff tears is usually non-operative. 65% of people over the age of 65 have rotator cuff tears, so we don't have to operate on every rotator cuff tear that comes into our office. Usually we can treat rotator cuff pathology or rotator cuff tearing with cortisone injections, anti-inflammatories, and physical therapy. If that fails, we can surgically treat rotator cuff tears with a rotator cuff repair. And most of the time we can do this using arthroscopy through small, minimally invasive incisions. Every once in a while we do have to make a longer incision over the side of the shoulder to repair the rotator cuff. This requires being in a sling for 6 weeks and then at least 2 to 3 months of physical therapy after coming out of the sling. However, most of the time we can get patients back to full function and pain relief with this procedure. If you are having shoulder pain and you are concerned that you may have a rotator cuff tear or rotator cuff pathology, please call us at OrthoGeorgia and we'd be happy to evaluate you.